Do you have watery eyes? Hi, I'm Dr. Shubhra Goel, Oculofacial plastic surgeon working at Apollo Hospital, Jubilee Hills, Hyderabad. Watery eyes is a very common entity which happens to all of us any time of the year. It's often misunderstood and is often treated by putting some simple eye drops inside the eye. However, the tear passage is a complex anatomical structure. It has a gland which produces water. We have eyelids which actually pump it. We have a surface which distributes it. And then we have a drainage passage which actually takes it out. So the watering can happen if you have problems in any of these structures. Meaning, if your gland is overproducing the tears, you can have watery eyes. If the lymph mechanism is not okay, for example, in blink rate, paralysis, then the water distribution is not happening properly. If there's a surface disorder, meaning you have allergies, you have some, surface abnormalities, again, the tear will not distribute and you may have excessive tearing. And last but not the least, if there is a blockage in the passage, which starts from the small holes which are puncta, the small tubes, the bag and the bigger tube, it can cause the drainage issues. So if you have a watery eye, please reach out to an oculoplasty surgeon to get it assessed properly. It may not be just an eye drop, it may need more than that. So based on where the issue is, the treatment is planned accordingly. You may need a surgical procedure or you may not need it, but it always is a good idea to get it assessed. Watery eyes can also be seen in children where they are born with blocked tear passages, and it's very important to get it sorted within the first year of their lifetimes to avoid any complex surgeries later on. Again, a lot of misconceptions in the market of how to treat it, where to go. So the best thing is to go to the right specialist and get it sorted. So watery eyes is not as simple as you feel. Yes, it is very common. Do come to a specialist, get it treated and get it sorted.